10 coffins arrive each hour, shrink-wrapped in plastic to protect those handling them. The gravediggers have been at work non-stop.
Itu prinsip dari kami, slogan.
We are never giving up, and our slogan is, maybe we're exhausted, but we can never give up. We feel afraid, particularly we're afraid of getting infected and bringing it to our families. But this is our duty, and there is nothing we can do.
Indonesia's healthcare system is on the point of collapse. Hospitals are full. Patients spill out into the streets. Instead of isolation wards, they use tents. And they have run out of life-saving oxygen. Patients must provide it themselves. Agus Sudamadi has brought his wife to hospital. They knew to come prepared.
Tanggap segala apapun yang kita bawa, udah ada oksigen, udah ada.
We brought everything we needed, including our own oxygen, so we didn't increase the burden on the hospital, since the oxygen supply in the hospital is empty. People who have oxygen are getting treatment, but the hospital doesn't know where to put patients without oxygen, so often the patient will get short of breath and die.
Indonesians have been left to fend for themselves, buying oxygen wherever they can. In the Pramuka street market in Jakarta, people search for unproven, potentially dangerous drugs, a desperate attempt to treat their relatives themselves, because hospitals cannot. The archipelago is in the midst of a COVID catastrophe. The government was reluctant to impose restrictions when cases began rising, and the Delta variant has torn through the population. Only a tiny fraction have been vaccinated. Even the few who have been jabbed, frontline medical workers who've mainly received China's Sinovac vaccine, are dying. The government says it will change its vaccination policy.
Also, the Indonesian government will provide the third dose of vaccines and booster to ensure the maximum protections toward the healthcare workers.
Okay, so there's not a particular issue with vaccines that are coming from China?
No. We started with the vaccine from China because that's available for us, and then we want to make sure that it gives the protections to the people. If it's not, then it has to be booster, and it will apply to any vaccines that will be vaccinated.
But cases keep soaring and the deaths keep coming. Day has